How does CF infection surveillance detect new pathogens? In cystic fibrosis, or CF, infection surveillance plays a crucial role in identifying new and existing pathogens in the lungs. This systematic approach helps guide treatment and prevent the spread of infections. The process begins with regular microbiological monitoring of respiratory samples, such as sputum or throat swabs, collected during routine clinical visits. These samples are then cultured and analyzed in laboratories to identify any bacteria, fungi, or other microorganisms present in the airways. One key aspect of this surveillance is the regular collection of respiratory samples from patients. By scheduling these collections, healthcare providers can monitor the microbial environment in the lungs. This allows for the early detection of new pathogens before they lead to significant infections or symptoms. Once samples are collected, they are cultured on selective media to grow and isolate any bacteria or fungi. Laboratory techniques, including biochemical tests and molecular methods, help specify the species and strains of pathogens present. This identification is essential for determining the best treatment options. Advanced molecular diagnostics, such as polymerase chain reaction assays and genomic sequencing, enhance the detection of pathogens that may be difficult to culture using traditional methods. These tools improve the sensitivity and speed of identifying new or emerging pathogens, which is vital for timely intervention. Infection surveillance also involves monitoring changes in the microbial flora over time. By tracking the appearance of new pathogens or shifts in dominant strains, clinicians can adjust treatments and infection control measures accordingly. This longitudinal data is invaluable for managing patient health. Furthermore, surveillance supports infection control practices by identifying transmissible pathogens like Pseudomonas aeruginosa, Burkholderia cepacia complex, and Staphylococcus aureus, which can spread between CF patients. Early detection of these pathogens helps implement targeted precautions to prevent cross-infection. Additionally, monitoring respiratory therapy equipment and clinical environments for contamination sources is part of the surveillance process. This helps ensure that new pathogens do not enter the patient population. In CF, the thick, sticky mucus in the lungs creates an environment where bacteria and fungi can thrive and evolve. Therefore, early detection of new pathogens is crucial. It enables timely interventions, such as antibiotic therapy or enhanced infection control measures, which can reduce lung damage and improve patient outcomes. Overall, CF infection surveillance combines regular clinical sampling, laboratory identification, molecular diagnostics, and epidemiological tracking. This comprehensive approach aims to detect new pathogens promptly, guiding effective management, and preventing their spread among patients. Always consult healthcare professionals for personalized medical advice and to understand the best practices for managing cystic fibrosis.